Good evening. First tonight, we rely on the NHS to help us in our time of need. But are some parts of the health service letting down their staff who have caring responsibilities?
In a rare interview, a senior doctor from Sheffield with a disabled son has said, in some cases, staff who are also carers can go unseen and unheard.
The NHS is one of the country's biggest employers, of course, and it has promised to improve the lives of carers. Here's our health correspondent, Jamie Coulson.
Come on, come on, come on. Warad is a delight. Warad is somebody who, very good lad, without saying anything, says a lot. He is a child who has allowed us to see a part of the world which we never knew existed. Well done.
For Girish Vaidya, being a parent also means being a carer. For 18 years, he's looked after his son Warad, who has cerebral palsy and needs constant care.
I feed him, I bathe him. He means a lot to me. This is the Becton Center. We admit young people here who have got emotional and mental health issues.
But Girish is also a senior doctor in the NHS, working as a consultant psychiatrist and clinical director for Sheffield Children's Hospital. Support from his employer has made it possible for him to continue with his career, but he believes there are many others in the wider NHS who struggle to access the help they need.
I have known colleagues who have had to give up work. I have known colleagues who have struggled to declare their caring responsibilities because they felt that doing so would mean that they would be looked down upon.
Research by the charity Carers UK estimates 1 in 5 NHS workers is an unpaid carer, compared to the England workforce average of 1 in 7. They estimate 72,000 NHS workers have left their job at some point because of caring responsibilities, the majority of whom are women.
It's like every organisation that is as large as the NHS. There are places which are hugely carer-friendly and really supportive and recognise that it's something that they need to do for a happier, more productive workforce. And there are other areas that haven't quite got there yet. And that's why we at Carers UK are calling for the NHS to lead the way.
How do we keep everything that's so great about our National Health Service?
In January, the NHS long-term plan included commitments to improve the lives of carers, including greater flexibility and well-being for those carers working in the NHS. Here in Yorkshire, the NHS say they've developed a series of measures to help unpaid carers. These include developing carer-friendly GP practices and the rollout of the Carers Passport, which identifies carers whenever they visit a healthcare setting.
Come on, come on. Okay, well done, well done, well done. He's a child who has made us feel proud, not only as his parents. He is a child who has made us feel proud in our professional roles as well, because he has enabled us to see the lives of the people that we treat. Come on, come on, come on, come on.
Like many NHS staff, Girish remains passionate about being a carer, and for him that means at home as well as at work. Jamie Coulson, BBC Look North.
Well, Fatima Khan Shah takes the lead on carers issues in West Yorkshire and Harrogate for the NHS and other organisations. It's very rare, isn't it, to hear a senior member of the NHS talk about this, talk negatively about the NHS. He obviously feels very strongly about it. Is this the NHS that you recognise?
I think every organisation that you work in will have elements of good and bad practice. I think what's really, really important is that there's an opportunity for us to recognise that carers come from all different professions. I think when we talk about carers, we often see them in a certain stereotype, but actually caring is a social level. It can happen to anyone from any race, background, socioeconomic position. And actually what we really need to focus on is the fact that this will have a massive impact on people who are having to balance work and caring responsibilities. And I know that from personal experience.
As patients, though, we want to be confident that healthcare professionals aren't so preoccupied or with issues at home or tired that they can care for us.
Absolutely. And, you know, I often have gone into work on sometimes 2 or 3 hours sleep. But what was crucial for me was an organisation that supported me.
You've got personal experience of being a carer.
So I was a carer for my mother-in-law for over 10 years. And I worked while I did that, and I was raising a young family. And it can be really challenging to balance all those different responsibilities and have a career, which is why many carers sometimes give up work.
I think we want to believe that the NHS does have this long-term commitment to its carers. Does it genuinely have that?
I believe so. I think it's really, really brilliant that the NHS have recognised carers.
But there are problems, obviously, aren't there?
There are problems, but every sector has problems and has elements of good and bad practice. I think what's really important to recognise is the fact that the long-term plan articulates in at least 33 places, I've checked, you know, recognising the contribution of carers, because carer awareness in general is not good. People don't realise or appreciate just the contribution that carers make to the economy, the equivalent to the NHS budget, which is £132 billion. I mean, in West Yorkshire and Harrogate, we've got 260,000 carers. 1 in 5 of our workforce will balance work and care. So as a leading employer, leading by example, it's important that the NHS, with our partners across West Yorkshire and Harrogate, work together to amplify the good practice that already exists. So I know many organisations in our partnership that covers West Yorkshire and Harrogate that do brilliant good practice supporting carers in the workplace. We're developing a working carers passport, which will be adopted by all the acute trusts here in West Yorkshire and Harrogate and the acute trust and beyond. So there are already exemplars, and we're just trying to amplify what exists. But what I really think is important today... Oh, sorry.
No, have you one final point you'd like to make?
I just wanted to say it's really important that we recognise just how challenging balancing work and care is, and that we need to be aware of the importance of carers, that they are in our workforce, and the first step is carer awareness, which I think we've done today.
Sorry to cut you off, Fatima. We've run out of time. Thank you very much indeed for joining us.